Secretary of State, what do you say to patients and NHS staff at this time of extraordinary pressure on them?
Well, the first thing I want to say is thank you to the staff of the NHS who are working under extraordinary pressure. The figures we've had out this week show that we had the busiest day in NHS history in December. And for staff on the front line, that means they get extraordinarily tired, a lot of mental, emotional pressure, a lot of time away from their families, and we all owe them a great debt for the fantastic work they do, and I want to recognise that. What they ask me is, what are you doing to help relieve that pressure? And a lot has happened in recent years. Every A&E department in the country has around 10 more doctors compared to 6 years ago, about 100 more nurses in every hospital trust. But when you look at the scale of demand that we've got, the increase in demand that's happening, we clearly need a much more profound change than that, which is why we have embarked on a big programme of transformation. How's it going? I think some bits are going very well. I think we have good plans in place to improve the capacity of our GP system. We need to deliver those plans. We're making good progress on mental health. Cancer survival rates are going up. But other bits are disappointingly slow. The integration of the health and social care system, the pressures on social care, those are areas where we clearly need to do more, as the Prime Minister acknowledged this week.
But you may have plans, but the pressure is right here, right now. Those plans don't seem to be helping, do they?
Well, right here, right now, we have, for example, this year, put nearly £4 billion of extra funding into the NHS, which is, just to give you an idea of the scale of that, that is more than the entire cost of the fire service, just as an increase to NHS funding this year.
But even with that, the system's under huge pressure.
It is, and that's why it isn't just about money. And I would say that one of the things that we need to do better at is learning from the A&E departments that have been coping well. We can see very good practice in trusts like South Warwickshire, Dorset, Luton and Dunstable, and we haven't been as good as we should have been in spreading that best practice around the system. I think there are also delays in terms of the links to the social care system, and it's been difficult discharging people, and we need to look at those problems, and that is all work that's happening.
The UK spends a lower share of its national income than France and Germany and some of the leading nations. Haven't you as a government got to face up to spending more money?
I think on spending there is a short-term and a long-term issue. In the short term...
And long-term spending per head falls, doesn't it, on current projections?
Well, that's not correct, actually. Over the
Came from the IFS.
Yeah, but over the period of this Parliament, the NHS specifically said could they have a big increase at the start of the Parliament, so that they can get going on some of the changes they want happening, but then a flatter profile during the rest of the Parliament. But if you look at France and Germany, to answer the direct question, I mean, on the measures that the OECD publish, I think of 35 measures, there are 14 where we do better than France and Germany. This winter, France had 1 million people with flu. Germany had cities where entire A&E departments in every hospital were closed on certain nights. So where I would disagree with some of the suggestions in your coverage is the idea this is a problem unique to the NHS. We are all grappling with the profound changes caused by an ageing population and by consumers who have much higher expectations. And I think whilst it is absolutely right to scrutinise the problems that we face in the NHS, we also have a duty to recognise some of the successes. I mean, this week, for example, we discovered that half the number of children are dying from cancer compared to 1990. Now, that is a huge success for the NHS, incredibly important to every family with young children. We also discovered for heart attacks that we've nearly doubled the number of people being seen within 90 minutes. So there are some very important positive things happening.
But in terms of what's happening now in A&E units, the BBC has shown images from Royal Blackburn of people waiting 13 hours, mothers and babies sitting in the corridor. Aren't you embarrassed about that?
Well, it is, incredibly frustrating for me. I'm doing this job because I want NHS care to be the safest and best in the world, and that kind of care is completely unacceptable. No one would want it for members of their own family.
But it's happening in a hospital rated good.
Well,
so what can you do about it?
Yes, what I think you have to recognise is that overall there are positive things as well as negative things, and there is huge commitment in the NHS to sort out those negative things, and the particular pressure point we have is A&E, and what we need to do is to find ways of treating particularly people with complex conditions, older people with dementia, treating them at home or in the community, and that is the big direction of change that we've embarked on.
But that is longer term. What we're seeing in hospitals right now is the sort of scenes we've been showing on the BBC this week. Real stress, real strain. The figures out show performance targets the worst since 2004. What can you do about it right now? Shouldn't you be doing more?
I think it's wrong to suggest to people that these profound challenges, such as we face with an ageing population, are ones where there's a silver bullet that you can solve the problem overnight. We have a very good plan. It has the support of the NHS. It will take time to deliver. But in terms of immediate support, we're doing what we can with extra financial support to the NHS this year, more doctors, more nurses. But we also need to row in behind people in the NHS who are working very hard to try and sort out these problems. And we also need the public's help, because we know that a number of the people who are seen in A&Es could actually have their needs dealt with in another part of the NHS, and we need to make sure that as far as we can we free up people in A&E departments to deal with the most vulnerable older patients who have particular needs.
There have been cuts to social care funding under your government. Hasn't that created the problem that we're now seeing? And what do you say to the family of Iris Sibley, featured on the Today programme? She had to wait 6 months in hospital before she could get a place in a care home.
Well, I don't want to make any kind of excuses for that. It is totally unacceptable. It is terrible for Mrs. Sibley, but it's also very bad for the NHS, because other people could have...
But it's not the only case of its kind.
No, and as I say, there are no excuses. It is completely unacceptable. What I would say is, on social care, the Prime Minister has been very clear. We recognise the pressures there. We recognise there is a problem about the sustainability of the social care system, and that has to be addressed, and we're going to do that.
More money in the budget?
Well, that's for the Chancellor and the Prime Minister, but look at what the Prime Minister said this week. This is an area where there is pressure, and if we're going to have a solution, it needs to be a long-term, sustainable solution and not a quick fix.
Secretary of State, thank you very much.
Thank you.
Thank you.